What's up, everybody? Today we're going to talk about cardiovascular training considerations and common injuries. Okay, we're going to start with the learning goals, understand the impact of age, sex, and genetics on cardiovascular fitness, understand the impact of environmental factors on cardiovascular fitness, recognize the signs of detraining from a cardiovascular program, understand how to prevent common overuse injuries associated with aerobic training, and understand the etiology of common injuries associated with cardiovascular training. So genetics plays a role. Training increases VO2 max by 10 to 30%. Genetics equals 50% of variation in gains. Larger stroke volumes, more type 1 fibers, greater mitochondria and capillary density, and higher myoglobin concentrations. So you can have, obviously, genetics that allow you to have higher stroke volumes, more type 1 fibers, greater mitochondria, and then some genetics, some people have, lower stroke volumes, lower type 1 fibers, which will be more people that are probably a little bit in the endomorph type of body style. Age, VO2 max declines 1% every year after the age of 25. So after you turn 25, you really have to make it a priority to increase your VO2 max. High aerobic fitness during youth reduces premature functional decline. So aerobic fitness is associated with higher longevity, higher quality of life, and sedentary older adults can improve 10 to 20%. So adults can still improve their aerobic capacities. Environmental factors: the human body cools itself via 4 methods: radiation, convection, conduction, and evaporation. So we're like, if you've ever heard of the law of thermodynamics, we're basically just burning. We're always trying to also burn energy, and then also we're always trying to cool ourselves down, especially in hot environments. So hot environments make it difficult for the body to lose heat via radiation, convection, and conduction. Hot and humid environments also limit evaporation via sweat, greatest risk for heart-related illness and severe dehydration. Okay, so acclimation to heat stress. Physiological adjustments to training in the heat include an earlier onset of sweating, increase in sweat production, distribution of sweat expands across a broader surface, increase in plasma volumes, reduction of sodium concentrate in sweat, improvements in cutaneous blood flow, distributing more heat to the skin, and improved overall thermoregulatory function. So when you acclimate to heat stress, it actually changes your physiology. And these are some of the adjustments per se. So you'll sweat a little bit later, meaning that you won't sweat as much in the beginning, so your body will have adapted to the environment. So you also won't get rid of as much sodium. You'll improve, how your body regulates thermoregulation. Altitude. So at higher altitudes, we've heard of athletes who work out in Colorado or in places that have high altitudes. Higher altitude reduces oxygen availability due to lower partial pressure. The body adapts to the relative lack of oxygen by increasing the concentration of red blood cells and hemoglobin. So you can actually increase the amount of red blood cells and hemoglobin by working at a higher altitude. And there's also altitude masks that you can wear, but I would not recommend any of those unless you're with a physician. Sex and gender. Females have a 15% lower aerobic capacity potential compared to males. They have smaller hearts, and that is due to their smaller body size, which is due to having not as much testosterone as men. They have lower stroke volumes, lower hemoglobin concentrations, less muscle mass relative to size, and higher body fat on average. So women have genetics that is kind of working against them a little bit here, but nothing that they can't overcome through training. Recovery. Novices, day on, day off. So take a day on, take a day off. For performance training, 1 full day of rest every 7 to 9 days of training. So making sure you are still relaxing at least 1 day, maybe just incorporating mobility on that day. and non-weight bearing work. Swim, cycle helps limit eccentric stresses. So swimming and cycling is really good to recover with. So getting on a bike, you know, going obviously for a swim if you can, are really important recovery tools. Detraining, so cardiorespiratory fitness, detraining starts only 14 days. So basically what happens is if you don't use it, you will lose it. Just like if you don't use your mobility, you'll lose your mobility. If you don't use your endurance, you'll lose your endurance. If you don't use your aerobic capacity, you'll lose your aerobic capacity. So detraining reduce blood plasma, stroke volume, and enzymatic shifts, reduce mitochondrial and capillary densities in 3 weeks. VO2 max declines, max stroke volume declines, max cardiac output declines, and a max A VO2 difference declines. But guess what happens? Your max heart rate increases, which is not a good thing. So we want a lower resting heart rate. We know a lower resting heart rate means that you have a stronger heart. Stronger heart means that you're getting more blood out to the body quicker. So there is a detraining effect. So it's not a good thing to train your VO2 max and then stop completely after. You'll have a detraining effect. So if you are training VO2 max, make sure that you're thinking about months, not weeks, and think about long-term goals, not short-term goals. So common injuries of aerobic training include initiating a training program too aggressively. For example, if you want to run a 5K, and you shouldn't start by going and running a 5K. Maybe it's just walking around your block. Maybe then the next day it's 2 times around the block. Then it's 3 times around the block. And then you take a rest day. And then maybe you repeat that for a couple weeks. And then you do 4, then you move it up to 4 and you do that for a couple weeks. So there are protocols as NCSF guides you through. So always stick to the protocols through NCSF or any other training programs. Previous injury, so if you've had previous injuries, aerobic endurance might actually aggravate it. So if you have a knee injury and you're doing repetitive running, you're gonna probably have more issues. So you gotta take care of previous injuries before you do it. Poor technique, you could be running with poor gait, poor posture. Your head could be leaning forward as you run. Your head might not be over your shoulders. There's a lot of things you need to think about when you run because your body wants to get lazy. It wants to compensate. It wants to kind of just stop. So you have to actively engage your core. Your chest has to be high. Head is over the shoulders when you run. And then also creating a nice cadence as well. You might have poor joint alignment. So if your right hip is, let's just say, a little tighter than the left hip and you're running, you might overcompensate on that left side due to the right hip. Muscle imbalances, same thing. You might be overactivating left gastroc over your right gastroc. You might be kind of getting a bigger stride with one side over another stride. An abrupt increase in foot impact repetitions during exercise. Improper footwear or support. Uneven gait caused by running on uneven surface, and inadequate warm-up protocol. So if you're not warming up before you go run, you're likely to get injured. So it's important to perform your mobility, dynamic stretching, maybe a little bit of walking, and then run. So common injuries: chondrocalcomania is hyaline cartilage of the knee. Plantar fasciitis, fascia is strained and inflamed. IT band syndrome, common among runners, causing lateral knee pain. Shin splints, pain along the inner tibia, and low back pain, imbalances, posture, gait issues. So these are some common injuries associated with aerobic endurance training. As far as injuries go, if you have any other questions, just email me or message me. And that's going to be it for cardiovascular training considerations and common injuries. Thanks.